Hi, everybody. A very good morning or good afternoon to you. This is a very interesting session. So we are continuing with our sessions on mental health uh, and and its treatment. And today we have with us Dr. Akash, and the topic we are covering today is sexual dysfunction and how to diagnose and treat it. Dr. Akash, welcome to the podcast. It's glad to have you here. How are you doing today?
How are you?
I'm good as well. So why don't we start with a quick introduction about yourself? I know you've had a stellar career. Introduce yourself, talk about your journey and what really motivates you.
Hi everyone, I'm Dr. Akash. I am from Andhra actually. I'm currently working in a clinic called Manoshanti in Bangalore in HSR layout. I recently come to this place. It's been around maybe 7 months.
Awesome. All right. So so now the topic itself, right? Sexual health is such a taboo in India. Um, so from your clinical experience and your education, why do people struggle so much to talk about sexual difficulties even with doctors?
So, if we look at it since our childhood, or whenever you came to understand what sex is, it is something which is considered as a taboo. Nobody wants to discuss anything because it is something regarding our private parts, it is something regarding our private moments, and it's something which we all came to know about as something which is uh, not socially acceptable or something like that. People always used to mock about it. They also get shamed about their orientation. Maybe we can go into that later, I guess. But again, people end up not speaking so much about whatever happens behind the bedroom, like within the bedroom, maybe. They wouldn't want to talk about because it makes them feel weak or makes them feel like they are not capable of some things, because at the end, in the Indian society, it is something which can, like, having the capability of making having children. Basically, making is not the right term here, but having children is something which is socially more acceptable. So if there's any incapacity in these basic functions, it is seen something as a sign of weakness, maybe. Especially for men, it is a sign of weakness. For women, it is a sign of incapability, if you can call it. So that is why people don't really reach out. Maybe they don't want the general public around them to know that they are having some issues, and that is why it usually stays hidden, I can say.
Yeah, I think you're right, Dr. Akash. I think awareness and acknowledgement really is the first biggest step towards understanding and trying and get it treated. Now, what are the most common sexual dysfunctions concerns you see today, both among men and women, that you see in your day-to-day life?
Uh, Maybe many of the people might be familiar with. I wouldn't say experience, like maybe they are experiencing, but for men, if you see, it's mostly something called ED, or it's erectile dysfunction, a difficulty in maintaining the erection of the penis. That can be one thing, and there's also something called premature ejaculation, like reaching the climax even before your partner is, uh, maybe you can call it having an excitement or anything like that. And these are some of the basic things which people really come across, especially men. And there's also something like anhedonia, or a loss of sexual interest. Uh, they don't feel sexually aroused for many reasons, which we might be discussing shortly. Those are a few things which men come across. For women, it's something like a loss of libido, generally a low libido. Might be due to social factors, might be due to some other hormonal issues or something like that. There might be also difficulty in arousal, like maybe there's no proper mechanism towards arousal. There's not enough foreplay if some women would want to mention to their partners. Uh, there's also something like dyspareunia or pain during the act of coitus. Uh, that would make them feel uncomfortable. That would also maybe feel the man worried or feeling incapable or something like that. And also another thing which we also need to see is that women, especially it is said in statistics that women are in India especially, they don't really achieve the orgasm because it's always the men ending up finishing the act without understanding or listening to the women. Like, might be because of their social understanding or their understanding of sexual experience not being enough. These might be some of the many reasons, many causes which we see in general, but yeah, we'll come across a little more later.
Yeah, I think uh, interesting that although it's a physical condition that manifests like other mental health conditions, but then do you see an underlying a sexual dysfunction problem purely physical, or is it linked to a deeper emotional or a mental problem, or we could separate out that and it could clearly just be a clinical problem at times? How often do you notice the similarity?
Sexual dysfunction, people, if we don't look at it properly, like if we, after the examination, like people would really come with some serious conditions as well. Like there might be some conditions where there's uh, actual issues in the genitalia, or something which is anatomically not very feasible for them to perform the act. But if we look at the majority of the issues, the sexual dysfunction or the act of sex not being done properly, the majority of them are psychogenic, except for a few causes, I would say. Most of them are dealt with psychiatric counseling, like reassurance would be the first thing. But again, we can't just jump into reassurance saying that okay, there's nothing over there. We, after examining everything, after examining all the possible physical causes, when we look at it objectively, it might seem like there's nothing else causing it, and it's mostly a psychogenic issue. So, yeah, next.
Okay, I think that's interesting. So now let's look at the other end of the spectrum, right? Could it be possible that a sexual dysfunction or a problem while having sex, all the conditions that you mentioned, could actually be a trigger for a mental health problem, the other way around?
That is one thing which is pretty common. Like, for example, we can look at it this way: a person, like a couple, is not really uh, having a very fruitful relationship, for example, and they are not really having a good performance. They're not having, you can call it as uh, a disturbance in their relationship or something like that, because which is caused due to the sexual dysfunction, you can call it. If that is the case, there would be maybe a person losing his confidence. The woman also might be losing confidence. The man would think, okay, there's something else that I'm not doing it right. there might be anxiety for his next encounter, if you can call it. So all of these things can lead to mental health, other mental health issues apart from anxiety. There might be uh, ongoing depression along with this. Like they would think that okay, I am not being able to satisfy my partner, then what am I even worth for? These kind of negative thoughts are also possible, uh, mainly because of not performing an act properly. And even as I mentioned, the low confidence uh, usually leads to these two conditions.
Uh, so how can someone tell uh, a difference between, say, a temporary sexual problem caused due to, as we all know, stress and work-related stress, or less sleep, and all these other factors could kind of increase uh, sexual conditions. So, how do you diagnose? Is it because uh, or a deeper clinical condition? How do you kind of distinguish between a sexual issue caused due to normal lifestyle factors versus a very deeper clinical condition which requires prolonged treatment?
We have to look at the timeline of what they are experiencing. If it's a short term thing, if it's maybe for a small duration or a few number of acts, and they're not really performing that well or not having the interest to do that, it can be due to some psychological causes, psychogenic causes, but it would, like, jumping directly into action, starting some supplements or anything, that would be a little, we can say, illogical to start immediately. Like people would start searching on the internet, what can improve my performance or anything. So rather than jumping into all of that, it is better to wait for a while to see if there's anything actually clinically more serious. So how do we distinguish between that? It is possibly the duration of the illness. If it's prolonged for maybe many months or years, uh, if a person is not married and these things are still happening, maybe does it happen to just one partner, and did it happen to previous partners as well, if there is any history like that. So we need to take a proper history of that, because some people might end up performing better as time progresses, but if it's still persisting and it is really difficult for them, it would be better to also consider the possibility of a more chronic disease, maybe get evaluated at a expert, I guess.
Okay, I think that's a fair point. Now let's go a little bit deeper into the psychological aspect. I think, I mean, there's a physical aspect to,
Hmm.
obviously, but I think the psychological scar that is, I think, more deeper in many cases. And I think you covered that on a couple of points that you made earlier. Now, if you go deeper, how do you think uh, does sexual dysfunction affect self-esteem or your feelings of masculinity or femininity, emotional intimacy, and how does this create a self-reinforcing cycle that kind of worsens sexual problems? So if you could go into the psychology a little bit, I think that will be helpful.
You're saying that how would this affect a person's self-esteem?
Yes.
So sexual acts are something like, especially in India, sexual sex education is basically not existent when they are supposed to learn. So they, most of the people end up learning or maybe just experiencing directly without learning when they get married. In most of the socially acceptable cases, if you can call it. In that case, they don't really know what to do in that situation. So a lack of reassurance will be there, especially when the partner is also not aware of this, and when they end up finishing the act, maybe uh, they might feel that okay, I haven't experienced this before, and that is why this is happening. Maybe my partner wouldn't uh, want me to be like this. So there will be an effect on the, I wouldn't say masculinity, we can just call it the self-esteem in general. Because there's also a high chance that there is possible exposure to other cultural aspects, like maybe their friends, or maybe they might also be guided by their parents. Even if it's not taboo, they would just say go in and come back or whatever, because even they are not really open enough to explain things to them. And there's also an exposure to pornographic material, which again that might cloud their judgment at times. This can also lead to some what do you say, unnatural expectations. This can also damage their masculinity or self-esteem in general. Uh, this can and also this can also the actors, for suppose, or some celebrities, for suppose, they might also be comparing themselves, especially during intimate moments. That can also lead to difficult self-image issues. So there are several factors, and also reassurance from the partner help them to not think about these acts, maybe think about these factors. And you can also say that that can itself build the self-esteem a little.
Right. Now, what is a typical diagnosis of a sexual dysfunction condition look like, and what is the treatment for it?
Again, most of the diagnosis, more than diagnosis, I would say most of the complaints which a person would come to an expert for, maybe it might be a psychologist or a psychiatrist, or maybe a sexual health expert. They would come for, most of them would be for not being able to maintain erection most of the times, not being able to prolong the act for a long time, or not being interested for a long time. So, jumping into the treatment would be a little unfair, because we also need to look at what might be the cause for this. Is it like some of them might be uh, not really interested with the partner as they did before, due to several features. They might be some interpersonal conflicts, or uh, there can also be an effect due to some substances. Even smoking or alcohol can also impact these things. In many of the cases, these are not the scenario, but people also wouldn't reach out to the doctor unless there's considerable what complaints from the partner as well. So if they do reach out, they probably don't really understand what might be the causes for these dysfunction. So we need to first explore all the possible causes. In the case that it might be psychogenic, if we understand that it's psychogenic, reassurance is usually the most important thing. Reassurance and a bit of counseling for the couple are the most important things. And there are certain techniques which are suggested by sexologists, they can also help with their intimate moments, maybe build up the anticipation, build up the excitement a little. These things can also help with them. And in case any of these fail, then they would go forward with other diagnosis. But these are the most common issues which they face, which don't really have an anatomical issue.
Do you think it's something that's treatable in most cases? Uh,
It is, yeah. It is pretty much treatable in most of the cases. Like they just need to come forward and be able to explain that they're going through these things, and they have to open up to their partners as well. If they are not really opening up, if they are just trying to deal with it themselves, maybe not uh, looking to meet experts, but they're trying to resolve them by themselves, maybe looking up in the internet or something, that might not be that helpful, but it is probably most of the times completely treatable.
uh, most patients or people who are suffering from this condition generally avoid taking psychiatric medicines because generally they worry about it. They feel that it might have some adverse effects, especially sexual side effects. So, what would you recommend? Is it possible that without medication, condition could be solved, or how do you handle someone who is concerned about the kind of medication that they have to take?
So, if we look at one of the most non-sexual, like not related to anatomical condition, which is depression. Depression is one of the most common cause of loss of sexual interest. Loss of libido is one of the cardinal causes. You can call it as a minor criteria for depression as well. So that condition uh, can cause complete or partially, most of the time there's no interest in sex. Whenever you ask the person, a married person or an unmarried person with a partner, they can mention that they're not interested as such. So the next thing would be the medication. The medication, which is usually the SSRIs, or the selective serotonin reuptake inhibitors. They are the or you can say the mainstay treatment for depression. But one of the most important side effect is loss of libido again. So it might be reinforced in some cases, but again, we also there's also a lot of research. There's also some medication which is uh, with better side effect profile. So there's a medication which doesn't cause these sexual side effects. These are especially for people who request them specifically, because I mean they might be similar in efficacy, but again they have the extra benefit of not reducing the sexual side effects. There are other medications as well, other conditions as well apart from uh, depression, but again, there also is a lot of psychotherapy available for people who do require, and we can also go about that as well whenever necessary.
So, who would they have to? Because you have psychotherapy, you have doctors, you have sexual health advisors. There's a whole bunch in the ecosystem. So, what would be your somebody really needs to look at who how would who should they approach first in this ecosystem, and what the roles does each one of them play? So, for example, when should they approach a doctor, right? A specific doctor, when they should approach a counselor versus maybe these days we have wellness advisors, we have coaches as well, intimacy coaches, all these ecosystems. So, how should they select who to go to and for what condition? Because that will help give clarity to somebody who has this condition and knowing, okay, I have X problem, I should go to X expert for or doctor for this condition, rather than going to the wrong kind of and getting the wrong diagnosis and treatment done, or not wrong, but basically not get the right kind of guidance.
So, as such, I would think that many of the experts themselves, they would try to deal with it by themselves, because pretty much sexual counseling can be done by many of the experts. Like even a normal doctor, a doctor who is not a psychiatrist, also can try to help this out, because reassurance seeking is not a very difficult thing. Like even the internet also can give reassurance. If they want to approach but they are confused themselves, they can approach any of them. uh, they would need to approach someone like a doctor for sure, only when they have any anatomical disturbance, if there's anything which is like a disorder to them. If they haven't gotten anything diagnosed, they can go to a doctor. If they wish to get counseled for it, they can approach a psychiatrist or any other counselor, any psychologist as well. If they want to specifically go to a sexual health expert, they can also do that. If they are able to prescribe medication, and if they do require medication, that would be even better if they went to a psychiatrist or a sexual health expert.
What about these coaches who also have kind of sprung up over the last few years?
Even I am not sure about the certification or anything, but if they are helping out and not prescribing anything as such, like some medication which can cause serious side effects, then that would be a problem. But if it's just some counseling, maybe coaching, if it's from a certified place, they are free to explore and try out things. Uh, but again, if it's really distressing and it is also causing other mental health disturbances, it would always be better to come to a psychologist or a psychiatrist or a sexual health expert.
Uh, Now, uh, what would you say to someone who feels, the first step is the big step, right? Or someone who feels ashamed, inadequate, or broken because of their condition. They understand that they have an underlying condition, but they are very hesitant. I mean, mental health, depression itself, general mental health conditions, people are so reluctant. Although it's improving with awareness and with as we get more educated and more, people, the taboos are getting broken. But what would you say to someone who's really uh, down because of it and hesitant to take that first step because of whatever reason?
I would say that okay, it is okay to feel inadequate, but it is not okay to feel broken. If they really need that kind of help, they should not hesitate. It is always better to approach for help. It's it feels a little uncomfortable at the start, but it's always better to uh, take help rather than being crushed by the sense of being without help. Helplessness is itself really distressing for anyone.
The last question I have is, what is the how do you approach this in at Manoshanti? What is the reason why your service is well regarded, and why would somebody opt for Manoshanti if they are suffering from this kind of a condition?
Manoshanti, the setup in itself, it is you can say it is confidential. We maintain that confidentiality with the utmost responsible manner. We have a team of psychiatrists and psychologists. We can give proper assessments. We approach in a non-judgmental way, which is one of the most important things. which a person would seek when they want to disclose uh, issues about especially sexual functions. So there would be that kind of assurance we are able to give, and regular follow-ups, regular assessments. If there's any distress, or if there's any unexpected outcome which we are seeing, we can definitely look into it. We can try to adjust, for example, the therapy itself, which we need to give to them. So, Manoshanti, in that space, it is a very safe space for people to approach, and yeah, that is what I would say.
Great, Dr. Akash. I think this was a very enlightening discussion. You covered a lot of topics that generally are regarded taboo in our culture, and something which is very rapidly increasing, and people encouraging people to seek help. So great. Thank you, Doc, and I hope you had a good session. Thank you, and have a good day. And thank you very much, Doctor.